Welcome to this presentation on applying Plan, Do, Study, Act, otherwise known as PDSA cycles, to improve assessment of home safety concerns. The Catch-Rural Falls program is supported by the Nebraska Department of Health and Human Services Office of Rural Health through the Medicare Rural Hospital Flexibility Program. The content of this presentation is solely the responsibility of the presenters and does not necessarily represent the views of our funding source. The Catch-Rural Falls program is led by myself, Vicki Kennel, and my colleague, Dawn Benema. We are both faculty in the College of Allied Health Professions at the University of Nebraska Medical Center. I am an industrial organizational psychologist with expertise in quality improvement in organizational science. Dawn is a physical therapist and brings the clinical perspective of fall risk reduction to our team. The educational objectives for this recording are the following. First is to describe the intended purpose of Plan, Do, Study, Act, or otherwise known as PDSA cycles. Second is to describe each element of a PDSA cycle. And third is to apply the PDSA approach to improve assessment of home safety concerns in your clinic. We discussed the three fundamental questions within the model for improvement in a previous presentation. So once you've identified specific testable change ideas, the next thing to do is to plan to test these changes. In this presentation, we will focus on the Plan, Do, Study, Act, otherwise known as PDSA cycle, as a method to study and learn how these changes work in your own local clinic environment. The PDSA cycle is a cycle for learning and improvement that can and should be repeated multiple times. This cycle promotes a trial and learning approach to improvement efforts by planning for, testing out, studying results, and taking action on what you learned in each test cycle to help you develop knowledge over time about how a change may result in improvement. We'll cover each of the stages of the PDSA approach in a little bit more detail in the following slides. And we'll use an example of one cycle that could be used to initiate some improvement efforts to improve the assessment of home safety concerns. So for P, what does the planning phase entail? The P of the PDSA cycle stands for plan. It could just as easily stand for predict. So the key to successful use of the PDSA approach is to ensure that each test cycle includes some clearly stated questions that you want to answer, predictions of what you think are going to happen in this test of change, and that you create a plan to test the change. Importantly, it's that you clarify the data that you need to collect to help you answer the question or the questions that you have in this test of change. So an example related to the assessment of home safety concerns is, let's say we have a clinic that wants to focus on improving the rate with which they assess their older adult patients for home safety concerns. So to initiate a very first test of change, one of the things that the clinic wants to answer is to what extent will our clinic increase our rate of assessment of home safety concerns by using or adopting a standardized guide to help guide the conversation about home safety concerns for their patient population ages 65 and older who screened positive for fall risk and are currently still living in their own home. The other question that they want to answer in this initial test of change is, what will staff report as some facilitators or barriers to completing this assessment of home safety concerns, knowing that the change that they want to test here is to use this standardized guide to help with the assessment. The predictions that might be made here, and again, each question should have an associated prediction. So for the first question, they predict that the rate of home safety concerns will increase from 25%, which was indicated by baseline data, to hopefully 50%. So we're reaching approximately half of the eligible patients over the next 2 weeks. And that staff will help to identify some successes and barriers to addressing home safety concerns using this standardized guide that they hope to address in the next test of change. So the plan that they intend to follow is that during the next 2 weeks, they've decided that all of the older adult patients who screen positive for fall risk will be asked about safety concerns in their home that might increase the risk of falling at home using a standardized guide that can be used to help facilitate this conversation and assessment of home safety concerns. So staff are given some in-person training and some written instructions for both how to use the guide and how to lead that discussion discussion or conversation with the patients about the specific home safety concerns that are included in the guide. So the data that they want to collect to help them answer their question and test their predictions is that in order to calculate rates of assessment of home safety concerns for their eligible patients, they're going to collect data from their medical records of all of their older adult patients who screened positive for fall risk during that 2-week trial timeframe. And then they need to determine which of those patients do and don't have home safety concern assessment results documented in the EMR. The other component that they need to keep in mind here too is that this population is also those older adults who screened positive for fall risk and are currently living in their own home. So they'll need to determine a mechanism to narrow the population to those criteria. So the completion rate is going to be those who have the documentation of a completed assessment of home safety concerns divided by the number of older adult patients who screen positive for fall risk and are currently living in their own home. To help with the second question, they're going to also talk to staff, but also ask staff to document their experiences and their observations of the current process for assessing home safety concerns in a separate document. I have here on this particular slide a really useful checklist that can be helpful for helping you develop the plan. Making sure that you're really clear about the objective of the test, the changes you want to test, the questions you want to answer, the predictions that you have, and then the measures that you want to collect, followed by the specifics of how you're going to design the test. In the PDSA approach, as it's intended, it is really important to have a really crystal clear plan because the plan really sets the stage for the rest of the test. So what you're going to do, the data you're going to collect, it helps to inform how you're going to study and analyze the data that you collected to see if the changes you are testing are actually helping to make some sort of improvement. All right, so we've created our plan. Now we're going to move forward to do. This is where we do the work. So we implement the tests that we planned. We collect the data that we propose to collect in order to try to help us answer those questions that we generated in the plan phase so that we can compare and look at our predictions to see if what we thought might happen in our test of change actually did happen. So in the do phase, we run the test of change, we're collecting and monitoring data. And the other important component here is that we also want to document any successes, issues, problems, or unexpected observations or things that happened along the way. So unusual cases, something in the environment that affected that test of change, maybe something that worked exceptionally well that we didn't expect, etc. Don't undervalue documenting these types of observations because this type of information is really helpful for learning and to help you put your analysis of data in the study phase into context. For our example of our assessment of home safety concerns, the team decides to initiate the plan. So for 2 weeks, the clinic's going to run this trial to offer an assessment of home safety concerns to all of their patients ages 65 and older who screened positive for fall risk and are currently living in their home. About a week into this test of change, staff had their regular monthly staff meetings, so they collected some feedback from staff. So staff were anecdotally reporting that the conversations about home safety concerns that are taking a little bit longer than they expected, as the standardized guide that they're using has actually helped to identify a number of home safety concerns that these patients are going to need to address to reduce the risk of a fall in their home setting. Some patients have been a little bit hesitant to discuss their concerns with staff, particularly when a family member or a caregiver is present at the appointment. All of the patients expressed some appreciation for the guide and the option of the ability to take it home with them so that they could further review the questions in their home environment, as that might trigger kind of their recall or what is actually present in their home environment. There wasn't enough time in the appointment to discuss home safety concerns for 2 patients that were seen in that week due to some other pressing medical concerns that needed to be addressed. So what the staff did in that case is they decided to just send the checklist home with the patients so they could review that independently. So the staff were encouraged to keep documenting their experiences and observations. And then after the 2 weeks are complete, data was pulled from the medical record for analysis. And they also further compiled and documented the experiences of staff from this 2 week test of change. Now we move on to study. So in the study phase of the PDSA cycle, we analyze what we learned from the do phase of the study. So remember in the do phase, that's when we're really executing our plan. So we're implementing the tests that we planned, we're collecting the data that we proposed to collect, because we want to try to answer the questions that we generated for this test of change, and compare our data that we collected to the predictions that we made about what we thought was going to happen while we were testing out this particular change. So the study phase is we take the data that we have collected and we analyze it. So we can compare what does that data tell us about the test of change in conjunction with the predictions that we made for this particular test of change. So this particular step is really analogous to the idea of conducting analysis and interpretation of results if we were following traditional scientific methodology. So in this particular example, the analysis revealed that the rate of assessment of home safety concerns increased from 20% to 60%, which was slightly higher than what they originally predicted. They originally predicted that it would be from to 50%. Staff meet again to discuss the improvement that was observed, and successes and barriers, and to try to brainstorm some of the next steps. So discussion from the test of change revealed the following. So staff reported that they liked the standardized guide to help them identify home safety concerns. They felt like the process was taking a little bit longer than expected, primarily because the process has been helping to identify multiple home safety concerns among their patient population. In some situations, the presence of a family member or a caregiver appeared to stifle the patient's willingness to discuss home safety concerns. In these cases, staff wondered if this was driven by a concern that the home environment could not be modified, or modified well enough, such that the patient might need to consider other living options to support their safety. Patients really liked the ability to take the standardized guide home with them so that they could review that while they were in their home environment. And then in addition to reflections on the process, staff wanted to talk a little bit more about some next steps for how to connect patients with appropriate resources for intervention, including referral to occupational therapy to really further conduct an assessment of home safety concerns in the patient's home environment. And then finally, we end the PDSA cycle with the ACT phase. So in the ACT phase of the PDSA cycle, we take what we learned from our study of this particular test of change, and then we use that information to start informing a direction and a plan for the next step. Essentially, what's the next course of action? So based on what we learned from the test of change, we might do one of the following. We might make adaptations. So maybe we need to modify something. Maybe it's the change itself, maybe it's the way we frame the problem, or the sample or the conditions under which we want to test this change, and then decide to run another test. We also might decide to adopt. So maybe we decide to test the same change, but we're going to do it on a much larger scale, to continue to gather data and evidence that might hopefully suggest that this change is actually contributing to or resulting in improvement. And then finally, we also could decide to abandon. So we're not going to conduct another test of change on this idea. We're going to go back to the drawing board or in the project without investing any further effort. We then proceed to start thinking about the plan for the next PDSA cycle. So the ACT component is a really critical kind of final step in this approach, because here's where we take the knowledge that we've gained from this test of change and we start to translate it into action. So you can kind of think about this as the glue, so to speak, of this sequential building of knowledge about the changes we're testing by using multiple PDSA test cycles. So in relation to our assessment of home safety concerns, the team decides that they're going to adapt, and then plan for the next test of change. So they want to keep using the standardized guide for assessment of home safety concerns, but what they want to do in the next test of change is to actually track like how long is this assessment taking, because the staff were suggesting that this was taking longer than expected in the first test of change. So they want some data to actually help document like how long is this taking on average for our patient population, and then we'll discuss any further changes to the process moving forward. So some future steps they also discussed were things like how might we start to discuss interventions for home safety, including referral to occupational therapy, and what might we be able to do to connect our patients with some community resources that they could leverage to help them make modifications in their home that might require skills from someone like a handyman or someone else with specific construction related skills or things like that. Additional discussion topics that came up included like how can we follow up with patients to see if they actually made any changes to address home safety concerns. So the PDSA approach is not intended to be like a one and done approach to improvement. So you don't just run one PDSA cycle and that's it. Rather, the purpose of the PDSA method really resides in multiple tests of change that are going to help us sequentially build knowledge. So we're collecting data and gathering information to see over time if our changes are in fact resulting in improvement. So we use this method to help us learn as quickly as possible whether a change is working in a specific setting, and then we make adjustments as needed to increase the chances of successfully implementing and sustaining that desired improvement. So the lessons learned from one cycle link together to help inform kind of the plan and the tests that we're going to run in the next cycle or cycles that follow. So with this in mind, we can use the PDSA approach to support the scaling up of changes and interventions from very small scale tests of change to much wider scale tests of change and into implementation. So that's the spirit of the PDSA process, and that's what helps us to build knowledge and confidence over time that our changes are in fact resulting in contributing into some sort of improvement. So with this particular slide, we're just giving you a couple examples. So the first cycle is kind of the cycle example that we talked through this presentation. If the team was going to move forward with a plan for the next test of change, again, this is just a snapshot. You'd have a much more detailed plan, but the staff might decide, okay, we're going to keep using the standardized guide. We're going to keep doing the assessments of home safety concerns for our patient population, but we're just going to make sure we track the length of the conversations in this test of change. So we have some concrete data to help to back up or validate the anecdotal information we have from staff that when they're saying that these conversations are taking longer than expected. So perhaps if they run this test of change, let's say the data does in fact show that yep, these conversations are taking longer than expected. Maybe they're taking an average of, I don't know, 5 minutes or 6 minutes or 7 minutes or something like that. The team might decide, okay, we want to keep the standardized guide because it is thorough, but perhaps one modification we could make to the process is we could ask the patient to review the checklist from the guide between when they've had a positive fall screen and when the provider or the nurse returns to the room. Maybe this will help to streamline the process. So the team could generate a more concrete plan to be able to test that in cycle number 3. So in that cycle, perhaps the staff decided, we're going to have the patients who are eligible for this home safety assessment review the checklist, after they're roomed, but while they're waiting for the nurse and the provider to return back to the room. So this is the kind of just the example of a start of what will hopefully be several PDSA cycles that can be used to try to help the team make some meaningful improvements and collect data to demonstrate evidence that their changes they're making to improve assessment of home safety are in fact working. Finally, here I have just kind of a quick summary of PDSA self-assessment. This is really just intended to make sure that we're using the method as intended, but you can use this as kind of a quick check for your team, especially as you're thinking about running PDSA cycles and tests of change over time. So in summary, the model for improvement and PDSA cycles are really useful tools to help guide efforts to improve assessment of home safety concerns. Making sure that you create a clear, focused plan for a small test of change is a really great step to help you get started. Be clear on the questions that you're trying to answer, because those will help to guide and inform the data that you need to collect in each test of change. So the questions really help to drive a lot of the decisions that you're going to make moving forward. And then finally, to remember that this is an iterative process. It's intended to run multiple tests of change, starting at small scale and working up from there, to help you generate evidence to show, hopefully, that the changes you are testing are in fact contributing to meaningful improvement over time. Finally, I want to leave you with a link to a tool that you can download from the Institute for Healthcare Improvement to help support developing PDSA cycles. In order to access these materials, you simply need to visit the link online, and then the IHI will ask you for your name, your organization, and an email address in order to download these materials for free.